Yalimadat, my brothers and sisters, thank you for joining us today. My name is Zara Shajani from Calgary, Alberta, and I'm the Aga Khan Health Board Chair for the Prairies. It is my pleasure to welcome you all this evening to this webinar on grief and bereavement. During our time together this evening, we will explore grief and bereavement with a focus on grieving process, understanding complicated grief, and relevant symptoms. This has been a very hard year for many of us. We have had to grieve the loss of our autonomy, social connections with our loved ones, and many of our loved ones dying and not having the proper opportunities to say goodbye. Joining me here today, I am honored to introduce you to a registered provincial psychologist, Rabia Kabani, that will walk us through strategies for coping with the loss of a loved one, as well as tips for supporting bereaved individuals. Rabia is a registered provincial psychologist with experience in counseling and assessments. She has worked with a diverse range of clients, including children, adolescents, adults, in both school and private settings. Rabia draws from a variety of therapeutic modalities, including cognitive behavior therapies and person-centered therapies. Her area of practice includes depression, mood-related issues, anxiety, stress management, grief, and relationship issues. Currently, she works out of a private psychology clinic in Calgary. Today, she's going to do a presentation for us, but at any time, if you have any questions, please feel free to put it on the chat box and we'll address it. But without further ado, I will pass it to Rabia to do the presentation. Rabia?
Thanks for the warm welcome, Zara, and I'm so pleased to have the opportunity to be here today in a virtual capacity to speak with everyone about what I think is such an important topic, which is that of grief and bereavement. And I think Zara has already done a great job introducing what we'll be talking about today. So I'll just jump right into the presentation. In terms of the agenda for today, I do want to take some time to define the concepts of grief and bereavement, as well as other related concepts within this domain. I also want to take a little bit of time to talk about the grieving process itself and give you an introduction to some of the theory that's related to the grieving process. And then finally, the second half of our presentation will focus on more specific and tangible tools and strategies for coping with the death of a loved one, as well as strategies for supporting bereaved individuals. So before getting into the content itself, I'd like to encourage you to just take a moment to reflect on your own personal experiences, and to just take a moment and ask yourself if you've lost someone before, and what that experience was like for you. How did you feel? Take a moment to think about what you did. And now I want you to shift your focus to think about how the way that we grieve has changed in the times of COVID-19. So I just want to get those gears turning, and we'll address a lot of this kind of as we move forward. Now, before getting into the definition of grief itself, I think it's really important to talk about some common myths or misconceptions about the concept of grief. And so as you can see, I have a number of them on this slide here, some that you may have already heard of yourselves. The first is that we only grieve deaths. And the fact of the matter is that grief is really a broad, all-encompassing term. And so we don't just grieve deaths, we grieve all losses. And there's many different types of losses. So for example, it could be the loss of a job, a loss of a relationship, maybe in the context of a divorce. Right now, many of us in the current state of the pandemic are grieving the lives that we once lived. So it's important to recognize that grief is really a broad term. However, we will be focusing on grief today in the context of death and dying. Another common misconception is that grief is an emotional response only. And while grief does have a strong emotional component, we also have a variety of other grief reactions that we will touch on today. The third misconception that you can see here is that we recover in a slow and predictable manner from grief. And really, I think as this graphic does a great job showing, grief is an uneven process. It's not exactly linear and it's not exactly predictable. It's also important to note that we all have individual factors that can impact the grieving process and how we grieve. So some of these factors that can influence how we grieve might include age, culture, our relationship with the deceased, pre-existing medical conditions, or pre-existing mental illness. The fourth misconception here is that grieving is letting go of the deceased. And so what I would argue here is that we don't let go of the deceased, but we find a new way to connect with the deceased. Really, we never fully detach. Another misconception is that grief ultimately ends. And really, what it is that over time, we actually just learn to live with the loss and we form a new enduring connection with the deceased. And finally, the last myth that we have here is that grief is a form of depression. Now, while symptoms of grief may overlap with depression, there are some stark distinctions between the two. And when I'm talking about depression here, I'm talking about clinical depression, something like major depressive disorder. And so really one of the main differences here is that when we're talking about grief, some of the primary feelings are centered around loss and emptiness, whereas in a major depressive episode, that's characterized more by, depressed mood and this inability to anticipate happiness and pleasure. Now let's get into those definitions. So grief is an internal process. Essentially, it is our internal experience of loss. And like I mentioned before, it is something that's very individual. Now, if you're to look at the literature on grief, there are a number of different types of grief that have been identified. For instance, one is anticipatory grief. So this is really grief before the death of the loved one, in anticipation. Right now, with factors like looming uncertainty about changing hospital policies and practices, or concern about how a disease may progress, can actually lead to feelings of grief in anticipation of a death. Disenfranchised grief is when we aren't able to publicly mourn a loved one's death. And given the current physical restrictions that we're experiencing, some of these cultural or external grieving processes may not be possible. Traumatic grief talks about this idea of when the circumstances or the nature of death was traumatic. And so, this could include sudden deaths. Something that can also contribute to grieving right now is the idea that many of us aren't able to say goodbye to our loved ones, again, because of certain restrictions in different regions. And finally, what you can see here is this idea of complicated grief, which is often used interchangeably with the term prolonged grief. And really, this is when those intense feelings of grief really just continue and persist over a long period of time. And complicated grief is something that we will definitely touch on in more detail as we progress. Mourning, then, is this external expression of grief. It's often cultural. So, for example, in our community, things like the funeral, other religious practices that we engage in, these are part of the mourning process. And then bereavement is the state of having suffered a loss. So now I want to take some time to talk about different types of grief reactions. As I mentioned on the myth slide, grief isn't just something that's emotional. We have so many different responses to grief. So examples of emotional reactions to grief could include sadness, anger, maybe guilt. Maybe we feel like we're on an emotional roller coaster. Physical grief reactions could include, sometimes some people experience actual pain associated with their grief, maybe appetite changes or sleep changes, maybe crying. In terms of cognitive reactions, this is talking about our thoughts. So maybe we're preoccupied with the deceased, maybe there's disbelief or confusion. In terms of behavioral grief reactions, this could include something like disorganization. Social grief reactions could include like withdrawal and isolation. And then also there are spiritual grief reactions. So it's not uncommon to see people questioning the purpose of things, lots of why questions. Sometimes when people are grieving, they may question their spiritual or religious beliefs. And then finally, there are also economic grief reactions. Some people may experience, financial instability after the passing of a person in the family who was maybe the sole or primary breadwinner. So the reason I'm going into this is just to help you recognize that grief is something that's all-encompassing and affects so many different domains. Now, in terms of grieving styles, there have also been a number of different grieving styles that have been identified. And you can see here it's more on a spectrum from intuitive to instrumental. And really, individuals can fall anywhere on this spectrum. Now, what I really want to emphasize here is that there is no one right way to grieve. Really, somebody can fall anywhere on this spectrum. Now, when I'm talking about intuitive grieving styles, what I'm talking about is individuals who are really expressive about their grief, who really want to talk about their experiences. That's how they get through that process. On the other end, instrumental grief is referring to people who process their grief in a very cognitive and behavioral sense. They might express things in terms of thought, analysis, and action. For them, they're really focused on practical matters, problem solving, and getting things completed. So again, there really is no right way. And then we can have people kind of falling anywhere on the spectrum. And that's what we would call more of a blended grieving style. Now, I think any grief presentation would be incomplete without addressing the 5 stages of grief, and many of you may have already heard of these. Now, what's important to note is that when these stages of grief were initially presented, or identified rather, this was through Kubler-Ross talking to dying patients about their own experiences about death and dying. And so these 5 stages of grief were identified. Now, over time, we have been able to sort of use these stages of grief to help bereaved individuals also conceptualize what they're going through. As you can see here, these stages include denial, so no, it didn't happen. Anger, bargaining, well, if only, they ate healthier, they would still be around. If only I did this, then they would still be here. Depression, not to be confused with clinical depression, but really that intense sadness, and then acceptance. Now, it's important to note that not everyone necessarily experiences any or all of these stages, nor do people necessarily experience them in a sequential manner. And more often than not, people sort of oscillate between these stages. What I sort of want you to take away from this idea here is just another way for you to be able to conceptualize your grieving process or somebody around you's grieving process. And I think sometimes it can just help to normalize what we're experiencing. If we take a thought of ours and say, okay, wait a second, I'm in the bargaining stage, and that's okay right now. Moving forward, I think the way that I really like to conceptualize grief now, and the way that we see it a lot in the literature, is more of looking at it as a process of acute and moving from acute grief to integrated grief. So essentially, there is a death of a loved one. And then for the initial months after the death, we're sort of in this stage of acute grief. And this can look like, there's a number of different symptoms here, but symptoms can look like shock and numbness, intense distress, poor appetite, restlessness, maybe sleep issues, guilt, poor concentration, and just intense feelings of sadness. Now, over time, as we adapt to the loss, these symptoms gradually decrease in intensity and become less frequent. Now, in integrated grief, we're able to basically resume our normal activities again. That pain slowly subsides. We've learned to integrate that loss into our life. Now, don't get me wrong, that pain is still there. We still miss those who have passed away. That doesn't stop. But the symptoms are no longer as debilitating as they once were. We've now been able to make sense of the loss and accept the reality. Now, occasionally, people might fall back into acute grief. Maybe, for example, there's a birthday coming up of the deceased, or there's another milestone like an anniversary, or holiday times like right now. But generally, that's just another part of the grieving process. We dip into acute grief and then we come back into integrated grief. For most, this is a healthy and permanent stage. I think a really helpful metaphor to conceptualize these terms is to imagine acute grief like a really deep and fresh wound where you feel intense pain. Now, that is a part of your body's healing process. I mean, perhaps if we were to ignore that pain and that wound would then just fester and we might ignore it, right? Now, as time passes, that wound slowly heals and it turns into a scar. That is like integrated grief. So that scar will always be there. It's closed now, but it's still raw to the touch. So when we go towards integrated grief, like I mentioned, that involves being able to adapt to the loss. And so really adapting to the loss involves accepting the reality and changed relationship to the person who died. Note that I said changed relationship to the person who died, not end of the relationship to the person who died, as well as optimism about the future. Now, on the next slide here, I have what I think is a very helpful video to help us really conceptualize and understand these concepts of acute grief and integrated grief and the overall grief journey. So let's hope this works for us here.
So the way I try to describe grief is imagine this is you, and everything about your life is contained within this. This is you. When a bereavement happens, there isn't an area of your life that isn't affected by that grief. It touches every part of you. And what we used to think is that over time, that became smaller and disappeared. But the thinking now is that actually this stays the same, but our life grows around it. We have all lots of other things that happen in our lives now, but this stays within us. And on certain times, anniversaries, birthdays, Christmases, whatever, you dip straight back into it. And then when that anniversary or whatever passes, you remember this part of your life again. I guess what I believe now is that this doesn't stay as dark and black inside us forever, and that somehow it changes shape and becomes a little bit more fuzzy, although it still remains there.
So you don't move on.
You just learn to have it. No, you just learn to have it as part of your life. So
I think that was just a really helpful video for me, at least, to really be able to conceptualize the concept of the grief journey. Now what I want to talk about is when grief becomes complicated. So let's take that metaphor that we were talking about and let's continue with it. So sometimes wounds become infected and they fail to heal. This is complicated grief. So that wound continues to cause immense pain and it seems to get worse. This is a potential sign that professional help may be needed. Essentially, complicated grief is when we aren't able to transition from acute grief to integrated grief. And it involves what you see on the slide here. So it's a persistent and pervasive form of intense grief. It may involve continued yearning for the deceased, a preoccupation with the deceased person and or circumstances surrounding the death, intense emotional pain, and it persists for an atypically long period of time and exceeds expectations for that individual's culture and context. And so this period of time can look different for different individuals. And generally, the literature says that people tend to adjust within about 6 to 12 months. But again, that is very different for every individual. So some symptoms of complicated grief can include what you see on the slide here. Now, what's important to note is that these are symptoms when they are prolonged and take over, and then they act as derailers in the grief process. So initially, these are natural and common responses to unwanted events. But if they keep persisting and if they derail that grieving process, that's when they become symptoms of complicated grief. So these may include things like difficulty accepting the death, emotional numbness or disbelief, difficulty with positive reminiscing about the deceased, anger or bitterness, maybe excessively avoiding reminders of the deceased, wanting to reunite with the deceased, loneliness or detachment, confusion about one's role in life, difficulty trusting others, and a reluctance to pursue interests. Overall, basically, complicated grief is taking place when an individual can no longer carry out with their day-to-day functions. So that's a brief overview of what this looks like, and it's important to be cognizant of what these symptoms are so that we're aware of potential red flags for ourselves, for example, if we are grieving the loss of a loved one, so that we know that, maybe it's time that we need to try something else, or we need to maybe to get some professional support. So let's now shift gears a little bit and talk about grieving during COVID-19. Basically, there is a potential for increased instances of complicated grief, whether the death is related to complications from the pandemic, or if it's related to from unrelated causes altogether, as risk factors may be intensified during the pandemic. Some of these risk factors could include like the suddenness of a death, not being able to visit loved ones before their death, with a lot of these constantly changing hospital policies and procedures. Limited access to direct or in-person support is another potential risk factor. Another one is absence of traditional grieving rituals and practices. I mean, for us right now, for instance, with Jamaat Khanas currently being closed, with reduced capacity for different things, we may not be able to engage in some of those traditional religious practices that we once did. And so that, of course, can impact our ability to heal in that grieving journey. Other things like ongoing stress and changes in other domains is another factor, and repeated reminders of the pandemic, such as through media or when we're talking to others. So the idea here is just to be aware of these, so that you know what can affect you, and then we can then take proactive steps to help ourselves. So with that, I'd like to kind of shift now to the second half of our presentation today, where I want to talk about coping with the death of a loved one. Now, most people are able to adjust with time with adequate social supports and healthy habits. Now, when talking about coping and adapting to the loss, I really like to talk about this framework here, which is known as Wardens' tasks of mourning. And essentially, this can be seen as some of the tasks that we accomplish in our grieving journey in order to heal. And these tasks are helpful to help us illustrate sort of what we go through in that process. So like number one here is accepting the reality of the loss. The second is processing the pain of the grief, really acknowledging what's happening and working through it. The other one now is learning to adjust to a world without the deceased. This can involve internal adjustments. So that could be made as you adapt to your new identity without that loved one who's no longer here. External adjustments as we take on responsibilities and learn new skills. And spiritual adjustments. This is as we grapple with questions about our belief systems and the meaning of life. And the last task here that we see is being able to find an enduring connection with the deceased while moving forward. Now, this, again, like I said, is more of a broad and general lens at that grief process. And now what I want to do is talk a little bit about specific coping strategies. Now, I do want to add in that the grieving process and some of these coping strategies are different for every person. What works for one may not work for another. And sometimes it is helpful then to reach out to other external resources, community supports, or even again, talk to a mental health professional and get additional support as needed. One thing that I think is very important is talking about our grief. This is important for a number of reasons. One, it can help us really to understand and process what happened. And also, it's a way of staying connected with and remembering our loved one. Now remember, avoidance can lead to isolation, and isolation can disrupt our healing process. So as you're comfortable, it is helpful to be able to share your grief story. So connecting with others, just kind of tagging on to this idea of talking about it, is super critical. Even if it's not always talking about our grief story, it is helpful to just connect with others. But you might be like, pause, wait a second, how do I do that right now when physical distancing presents so many challenges? Well, that is the reality of the matter. And so we do have to brainstorm some more creative ways to stay in touch with one another. For instance, you might want to let your friends and family know, or your support network know, that you're okay with them checking in on you, whether that's through text or a phone call or a FaceTime, whatever that might look like. Maybe it's scheduling conference calls with your family and friends. Some people might find it helpful to request their family and friends to share stories and pictures about the deceased over, through mail, phone, video chat, social media. Others may find it useful to schedule a time with family and friends to honor the deceased over, using an online platform. Maybe that involves, reminiscing and sharing stories. Maybe it could be a recitation of a poem or a story or something that ties everyone to the deceased. For people that live with other people within their home, maybe it's praying collectively with members of your household. So again, this is just a starting point. There are many ways that we can still stay in touch and connect with other people. These are just some ideas of things that we can do. Another really important part of coping, in my opinion, is accepting grief and managing one's emotions. And I think first and foremost, it's important to understand that grief is a natural reaction to loss, and it can come and go in waves, and that's okay. In addition, I think it's really important to begin to recognize and label our emotions, both unhelpful emotions and positive emotions, without judgment. For instance, oftentimes when people are grieving, maybe if they're enjoying something or feeling happy, this might be associated with guilt, and there might be a tendency to want to suppress that emotion. What I would encourage you to do is to identify that emotion, see where it's coming from without judging it. Ultimately, suppressing our feelings can prevent us from moving forward. Once we're able to identify how we're feeling, we can actually make sense of what's happening. We can make sense of our internal world. We can understand what's within our control, and we can take relevant action. It's important to remember that our emotional pain doesn't control us. While it may seem counterintuitive that really leading into our emotions might let that control us, really it's us bringing that control back. Now, it's important to note that if you are feeling stuck or overwhelmed by your emotions, it may be helpful to talk with a mental health professional. Another really important element of coping is self-care. I cannot emphasize self-care enough. And I think oftentimes, when we think of what self-care is, and we maybe look at the media or films or whatever else, we might look at self-care as just going to the spa, getting a massage, getting a mani and pedi, but it's really so much more than that. Self-care is taking care of yourself. It's finding ways to actively maintain your health and well-being, as well as taking the time to do things that you enjoy. Really, I like to define self-care as finding ways to nourish your mind, your body, and your soul. And there are so many different domains of self-care to be mindful of, like our physical domain. So thinking about our physical health. So maybe it's ensuring that you're getting adequate sleep and rest. Maybe it's looking after your nutrition and diet, of course, as much as possible. Getting in that exercise, maybe going for a walk, doing things that you can to look after your physical health. Emotional self-care might look like stress management, doing relaxation exercises, things that can, maybe talking to a therapist, things that can really help you with your emotions and managing those. Social self-care might be setting appropriate boundaries with people around you, or creating support systems and support networks for yourself, taking time to communicate with other people, just hanging out with your family members. Maybe it's asking for help. Spiritual self-care is another really important domain here. And again, these can look different for different people, but for some, this might include meditation. Maybe it's taking a mindful walk in nature. Maybe it's praying at home. And then, of course, professionally, or when it comes to school for students, this is another domain to consider when thinking about self-care. Things like setting appropriate boundaries as you can, taking breaks, whatever that may look like for yourself. I think another important part of coping is being able to create memories or rituals. And really, I think that this comes back to this idea of being able to create that enduring connection with your loved one, coming back to those tasks of mourning that we touched on earlier. And so memories are really essential in maintaining that sense of connection to the deceased. Now, I understand that events like anniversaries, other milestones, holidays like currently, can really present difficult times. We can also try to reframe our perspective and see these as times for remembering and honoring the deceased. So some creative ideas for creating memories or rituals might include like creating a virtual memory book or blog or web page to remember the deceased. Maybe you want to consider asking family and friends to contribute their memories or their stories about the deceased. Maybe it looks like participating in activities that have significance to you and the deceased. So maybe planting a garden in their memory, preparing a favorite meal, donating to a charity that was really close to the deceased heart. Ultimately, what you choose is up to you, as long as you're comfortable with it and something that feels right to you. So these are just some ideas to think of, especially in the times where we're living in more of a virtual world. These are some ideas that you might want to use as a starting point. And finally, I can't emphasize enough about asking for help as another form of coping. It is okay to both accept and seek out help when needed. Now, we talked about complicated grief. We talked about certain symptoms that people might be experiencing as part of their grief processes. We talked about certain risk factors and additional stressors that are placed on us in the context of COVID. So you may want to consider seeking professional counseling or mental health support services. Now, I understand that currently it may be challenging to physically access such services, so maybe it's about finding places that offer services over the phone or virtually. You may want to also seek support from those in your religious community as applicable, or maybe seeking informal support from friends and loved ones. But ultimately, I would encourage you to really reach out and ask for help as you needed. So now let's move over a little bit and talk a little bit about how we can support those who have been bereaved. So I've talked a lot about specific coping strategies and tools that those who are bereaved can use in their grief journeys. And one of them was asking for help. So let's now talk about how someone as an outsider can provide help to a loved one who's lost someone. So I do want to
Rabia,
note
before
here
you
that
move,
we can feel
there's a few questions that I think that are coming in that might be relevant to what you've just said. So are you okay if I just
sure.
give you a couple of questions? So just in
Yeah,
terms of what
absolutely.
you said about there's one question here about how does one eventually come in terms with a loss? And how do you support a loved one who still is crying daily over the loss of a spouse and it's been more than a year?
Okay, so how to support someone who's been crying for more than a year. And do you mind repeating the first one?
The first one was how does one eventually come in terms with a loss?
Okay, so let's talk about the first one. Coming to terms with the loss, I think, is different for every individual. And I know that's not the right answer, the answer that people tend to look for, because we often want a simple and straightforward solution. There isn't necessarily one, but what I do think is really important, like I mentioned earlier, is being able to talk about it, embracing your grief story, really allowing yourself to talk about what happened, process what happened, go through those feelings as opposed to suppressing them. Oftentimes, when we suppress our feelings, they might build up and come out in other ways. And so, really, I would encourage you, and again, maybe with the support of a mental health professional, to go through those emotions, identify them, and see what you're going through. It might also be helpful to join a support group, looking for online forums, things like that to help you through the grieving process. Ultimately, it is going to look different for everyone, and I would encourage you not to be hard on yourself either, because that timeline can look different, and it is difficult to come to terms with the reality of it. Remember, we go through different stages. Sometimes we can reach integrated grief and we lean right back into acute grief. So it's also about being fair and reasonable with ourselves. In addition to, in regards to the question of how to support someone, who's really been in a lot of distress, it's been more than a year, I would say that's a very specific question. And so ultimately what I would say is it's very important to, maybe talk to, again, a mental health professional or someone around you. Generally speaking, however, I think it's important to just be present. And we're going to talk about that a little bit right now. And I think really one of the important parts of being able to support and help someone is displaying empathy, right? So this person may be crying, and maybe that's the way that they need to deal with the situation. Remember, we talked about different grieving styles, like intuitive and instrumental. So some people might need to express their grief more. And so being present and allowing them opportunities to do so. Also, I think a large part of supporting others is not doing everything yourself. Sometimes it's about knowing about what resources are available and referring people to those community resources. And we are going to talk a little bit at the end of today's presentation about some resources that you may find helpful. I hope that helps with those questions. And we can absolutely come back to some of those discussion points as we move along. And some we might also address some things in a bit more detail as we move on here. Now, like I said earlier, I do want you to remember that every individual's grieving process is unique. So there really isn't a one-size-fits-all approach. And at the end of the day, just remind yourself that more often than not, just being present with someone can be immensely helpful. Now, when I'm going to be talking about supporting others who are grieving, I am going to be talking about more of it from an emotional, sort of empathic, supportive standpoint. But I also want you to note that sometimes practical support can be really helpful too. Right now, for example, there may be people in COVID who are housebound. Maybe there's a senior who lost their spouse and they can't leave the house right now, get groceries or whatever else they need. And that then can actually contribute to the stress that they're feeling. So maybe it's offering practical support where you can, dropping off groceries, something like that can also be something useful to keep in mind as well. So don't just limit it to needing to talk to the person, but there are other ways, practical ways, to also be there for those who are grieving. So I think one of the things that we often struggle with is reaching out. And I get that. It is difficult. But I would encourage you, if you feel comfortable, to start a conversation, to reach out, to be open and honest, to share what you're concerned about, and just talk about it. Remember, we talked about it earlier. There are creative ways that we can stay in touch with each other. So maybe it's sending a WhatsApp or a text message or an email or a phone call or a video chat. Finding creative ways to stay in touch. And then here are some specific sort of strategies for how you can be supportive in the moment. And I think one thing that's really important is using active listening. And really, it's exactly what it says. It's being there. It's listening to the person, giving them that opportunity to share their grief story and what they have to say. Ask them how they feel. Be willing to sit in silence. I think oftentimes when we're having conversations, and hey, I'm guilty of this too, while we're listening to people, oftentimes we're already formulating our next response, what we're going to say next. Really, what I would encourage you to do is not worry about what you're going to say next, but just be present in the moment with that person. Really hear what they have to say. Being patient and non-judgmental. Now, I know that's easy to say, and an important part of being non-judgmental is to be aware of our own opinions and biases ahead of time so that we can put them aside. If you offer to check in, be sure to follow through with those commitments. Now, I do want to note here that when you offer to check in, it's always important to be mindful of your own capacity, your own mental health, and setting your own appropriate boundaries and thinking about your own burnout. So if you aren't able to support someone, perhaps, not giving those offers of checking in, looking after yourself first, and then offering to check in when you know that you're able to follow through with those commitments. It's also important to recognize that culture, religion, context, age, so many different factors do impact that grieving process. Like I mentioned earlier, like with the question where somebody asked how they can support somebody who's going through a lot of distress for a really long period of time, oftentimes it can be helpful to educate yourself about relevant resources, right? It's not about recreating the wheel here. There are a lot of resources that exist that can help people. And sometimes it's more about educating ourselves about those, educating ourselves about different types of supportive professionals in the community, and referring individuals onwards. And finally, I think it's very important to display empathy. Now, I had a video here that I was going to show, but I do think that we had some issues with the first one in glitching, so I will skip over it. But I highly recommend if anybody wants to learn a little bit more about the concepts of empathy versus sympathy, there's a great video by Brene Brown, and perhaps I can throw it in the chat later, and I would encourage all of you to watch it. It does a really great job of talking about, what empathy is. But really, there are some really important qualities when it comes to empathy. One is perspective taking, really being able to put ourselves in somebody else's shoes. Like I mentioned earlier, staying out of judgment. And finally, just feeling with people, allowing ourselves to recognize what other people are feeling and communicating that back to them, to show them that we are present and that we are listening to what they have to say. Now, while talking about this notion of supporting other people, I think it's important to take a few moments to talk about supporting children who may be grieving. Now, I know that today's presentation is more general, and I'm talking about mostly I've been talking about adults, but really I want to just take a few moments to acknowledge this specific population of children and adolescents. And it's so important to recognize that children and adolescents' grief reactions can really differ depending on both their age and their developmental levels. It's just something to be mindful of. Like, for instance, very young children may not be able to understand the finality of death. Slightly older children, maybe between that like 5 to 9 age group, maybe begin to comprehend the finality of death, but see it as something that doesn't happen to them. It would happen to other people. And then older children may then begin to really understand the causes of death, see it as something that's final and inevitable, and the cessation of bodily activities. Another thing to notice, to be aware of, is that you may see some developmental regression in children sometimes when they're grieving. Maybe you're now seeing children acting out, or young children becoming excessively clingy, maybe some separation anxiety, or maybe we're seeing withdrawn behavior. So you might see a range of things depending on age and stage. So it's just, again, something to be aware of. Now, what are some tips then for supporting grieving children? And a lot of these are going to overlap with what I talked about, generally speaking, when it came to supporting adults as well. But I think first and foremost, it's important to be open to discussion. And when discussing the loss or the death, to use simple, honest, and straightforward language. Like I discussed earlier, listen to and validate their thoughts and feelings. You want to create a sense of safety. And oftentimes, for example, for children who have lost a primary caregiver, that can be really difficult, and it can really disrupt their entire sense of safety in their world. And so doing what you can through, setting routines, consistency, structure to sort of recreate a sense of safety for them. Also, talking about the deceased and allowing children opportunities to share their grief stories. Again, not forcing this out of them, but just letting them know that this is a safe place for them to share their grief stories. Like we talked about a lot earlier, sometimes, we want to find tangible ways to maintain a connection to the deceased. So maybe it's finding activities and rituals that will help the child do that. Maybe it's drawing a picture together of the deceased, or drawing a picture of one's family, talking about what they miss, maybe setting aside like weekly meals where you can talk about the deceased and remember them, whatever that looks like for you and that child. And again, empathy is imperative here. And then you also want to remember to take care of yourself to prevent burnout, like I touched on earlier. I think that's so critical, especially right now with all of the different stressors that many of us are facing. Many of you might be familiar with the oxygen mask analogy, and it's something that I use quite frequently in my work. And it's this idea of, when you go on the airplane, when they're going over all the safety instructions and directions, they always say, put your mask on first, then everyone else's. So it's always important to just do those regular check-ins to say, how am I doing? Am I doing okay? Can I carry this today? Can I help this person? Do I need to give myself a break first? It's always important to be mindful of that. And finally, like I've discussed earlier, it's always important to reach out for additional support if needed. And with that, I think that's a helpful segue into the next portion here, which is where we're just going to briefly touch on resources. So with that, I'll just pass it over to Zara.
Well, first of all, I just want to say thank you. I think there's a lot of information that you have shared with us. Some of the things that I have written down here, just as a takeaway, is really, talking about accepting grief, managing our emotions. Another important message that I heard is changing our mindset, thinking about our relationship as not ending, but changing. I think that's a really important message that we heard from you, Rabia. And the other one is really understanding our grief process when we think about it from an acute grief. into integrated grief. I think that was a really important component that you talked about. But moving on, you did talk a lot about taking care of yourself, nurturing your mind, your physical body, your spiritual mind, which is, excellent tips in terms of, everything that's been going. One of the other things that I noted is, creating memories or rituals. I think that was a really important one, and really honoring our deceased and our lost loved ones, because I think that's really important. And the last one, which we'll talk about, is asking for help and reaching out. And this is where, we have provided some resources here, and one being the access line. Of course, if you're struggling, if you're thinking about acute support, and you need to get something right away, or it's an emergency situation, then I think it's important to call 911. But if something that you want to reach out for mental resources, or you want to talk to a healthcare provider to navigate those resources, either in your area or in your province, Access Line is a great resource, where we've got Ismaili healthcare providers on there available, their health line, and you can leave a message. They'll get back to you, and that you'll be referred to the appropriate province, wherever you are. The other resources are also, there's national resources. We have provided a PDF resource handout, and you'll see on there some national resources in your area. There's provincial helpline as well. So depending on where you're at, if it's acute, always remember to call 911. But if something that you want to reach out to a mental health or a psychologist, there are resources there. So you can just go to your province and have a look to see what those resources are. So we're going to move on to the next part of our presentation, and it's really having a Q&A with you, and it'll be a little bit informal, but I've already asked a couple of questions to kind of set us going at the beginning, but there are other questions here. One of the questions, Rabia, that's coming up is, could you suggest ways to say goodbye to loved ones if COVID restrictions are keeping them apart, especially during their end stage or when they're at palliative care?
Yeah. Well, first of all, I want to take a moment to just acknowledge how difficult that must be. Losing someone without that ability to say goodbye, or with certain restrictions, can be so immensely challenging. And really, my heart goes out to you. I think this looks different for everyone, and it really does depend on what those restrictions look like. But some things that I think that I would maybe suggest trying is maybe writing a letter to your loved one and dropping that off if that's allowed. Regular phone calls and video calls where you can kind of share stories and talk to each other. I know a lot of hospitals are providing like video chat at the end of life, so maybe it can be writing something ahead of time that you really want to share, getting your thoughts in order, talking about that over a video call. Maybe it's, if they have access to a phone at the hospital, like we talked about this idea of creating a virtual memory book. So maybe it could be like a page or something where you and family members can share your stories and your goodbyes, and that person can see that there and maybe have an opportunity to respond. Like you'll want to consider security and privacy and whatever not, but maybe like a private Facebook group where you can share stories with each other. So those are some suggestions that I would have off the top of my head, that may be some creative ways to stay in touch. And to also be able to have that goodbye.
Excellent, thank you. Another question that's coming through here is, could you give us some do's and don'ts for supporting someone who's grieving?
Yeah, I think that's something that's a little challenging, but for sure, I think really in terms of do's, we went over a lot of those already. And I would say it's being present is really important, right? Using that active listening, avoiding taking a judgmental stance. If you are offering to check in, following through with those commitments, really displaying empathy, showing perspective taking. I think some sort of maybe challenges that you might want to avoid, or some pitfalls that you may want to avoid, is telling other people how they feel. Oftentimes that can be a challenge. Or maybe imposing your grief story on somebody else, like, I've been there, I know what it's like. That can also, I think, be really challenging. I think not really being able to fully listen to what someone has to say, interrupting, those are things that you want to avoid. Excessive questioning can be something, like if you generally, you want to ask one question, allow the person the opportunity to respond before proceeding to another question. I think overall, if you follow some of those general do's that we talked about, those are useful. Ultimately, I wouldn't want you to feel scared of doing something wrong and not reaching out to someone. Really, it's just about reaching out, being there, being as supportive as possible.
Thanks, Rabia. Another question that's coming through is, are there any red flags that we would need to be aware of, someone who's going through grief, and when we should be worried about them, or, any kind of red flags that you can identify for us?
Yeah, I think really that that slide where we talked about some of those symptoms of complicated grief are really helpful for us to be able to be aware of certain red flags. Again, like I said, a lot of those symptoms that I touched on are initially natural reactions to grief and loss, but if they persist over a really atypically long amount of time, like I said, generally kind of that 1 year period is when people are able to adjust within. Again, clarifying here that people are still going to miss their loved ones. Sometimes we might still fall back into a bit of that acute grief. But if you're seeing that they're really just stuck after a long period of time, I think we've highlighted some of those symptoms there that can present as red flags. If you're seeing like persistent low mood after, a long amount of time, an inability to carry out day-to-day activities, like say this individual for over 1.5 years now has been sitting at home, not wanting to do anything, isn't really able to function properly, that might be a sign that it's time to reach out to them and see if they need additional support. Maybe if they're expressing an excessive desire to join the deceased after a really long time, just a preoccupation with the deceased. It's also important to watch out for signs of depression. So again, are we seeing that persistent low mood, after a really long time? Are they still not really able to take pleasure or satisfaction out of things in life? Are they expressing thoughts of suicide? I think these are some red flags to be mindful of.
Excellent. Thanks. Rabia, just on that note, could you tell us a little bit in terms of
I apologize, Zara. I can't really hear you on my end. Do you mind repeating that? Sorry, I'm still not able to hear anything.
Okay, can you hear me now?
I can, yeah.
Okay, sorry. What I was saying is that, can you tell us in terms of the difference between a grieving process and maybe somebody who's going through a mental health, if they might be going through depression or anxiety?
Yeah, I think, again, this is challenging because there is oftentimes a lot of overlap between what we see in one's grief journey and what we see in, other mental health area, like other areas of mental health, like depression and anxiety. That being said, if we're to really kind of compare grief to like a major depressive episode, like I mentioned earlier, grief really involves those predominant feelings of emptiness and loss. Whereas in a major depressive episode, we're really just seeing that persistent depressed mood, this inability to anticipate happiness or pleasure. In grief, the dysphoria can come and go in waves, whereas in like a major depressive episode, it's something that's persistent. In terms of like thought content for somebody who's grieving, this might, in the grief process, this could involve more of a preoccupation with the deceased. Whereas for those who might be experiencing depression, those thoughts might be more of like a self-critical or pessimistic nature, ruminations. Generally, for the most part, like self-esteem is preserved in those who are experiencing grief. And really, if there is some self-esteem issues or self-critical thoughts there. They might be around like perceived failings in relation to the deceased. And then oftentimes in grief, if individuals are experiencing thoughts about death and dying, it's more about wanting to reunite with or join the deceased, whereas in depression, it's more related to, feeling worthless, not being able to cope with the pain of the depression, feeling undeserving of life. So I think those are some helpful distinctions there. But again, being mindful of the fact that there is definitely overlap between the two, and comorbidities can exist, right? So somebody can be grieving, but they may also have, a depressive disorder or an anxiety disorder.
Thanks, Rabia. We are at our final question here. What if you're just stuck in a complicated grief?
Yeah, I think that is definitely just so difficult when you just feel like you're so stuck and you're trapped in your grief. And in those situations, I really would suggest looking into getting professional help. There are therapists, registered psychologists, mental health professionals who specialize in these areas, who have done a lot of training in these areas. So I would suggest, going on the internet, doing some research, finding somebody who you think might be a good fit for you, setting up an appointment, doing some research, finding, maybe accessing some of the resources that are in the handout, some community-based resources. I think those are things that you might want to consider, especially if you're feeling really stuck. That might be an indication that it's time to look elsewhere and get some additional support.
Thank you so much for sharing all of the wisdom and all of the information today with us today, Rabia. I think that this is such an important topic, but it's so heavy. So, thank you for, providing your wisdom, and thank you everyone for joining us today. And again, this is an area that, takes time. So please don't forget there's resources that we've handed to you to have a look at them, and also reach out to ask for help. And, we're here through Access, and also, if it's something that you're okay with, talk to your healthcare provider as well with what you're going through. So thank you again, everyone, for joining us. Yali Madat, everyone.